What is an ectopic pregnancy? What are the symptoms of an ectopic pregnancy? And how do we treat an ectopic pregnancy? If you're new here, we talk about all things periods, pregnancy, sexual education, and everything in between. So make sure if you like what you see, you share this with your friends. In this video, we're going to talk all about ectopic pregnancies. We're going to talk about what it is, the risk factors for it, the symptoms, how it's diagnosed, and how it's treated. So let's get into it. An ectopic pregnancy occurs when a fertilized egg implants outside of the uterus. In most cases, an embryo will implant in the fallopian tubes. However, it can also occur in the ovary, the cervix, or even in the abdominal cavity. Most commonly, 95% of the time, an ectopic pregnancy will occur in the fallopian tube. So that's what we're going to be focusing on today. The fallopian tubes are the ducts that are connected from your ovaries to your uterus, and that's where the embryo is supposed to travel along after it's been fertilized by sperm. When the embryo implants in the fallopian tube, it causes the tube to stretch, and this causes bleeding, and eventually the tube ruptures. When the tube ruptures, there's severe pain and internal bleeding. This is why it's so important to diagnose an ectopic pregnancy early. So let's talk about some of the risk factors that put you at higher risk for having an ectopic pregnancy. The first one is prior ectopic pregnancy. If you've had one before, you are at higher risk for having another. Also, any type of pelvic inflammatory disease, so chlamydia, gonorrhea, that kind of thing, can cause scarring and inflammation of the fallopian tubes, which makes it harder for that embryo to travel down into the uterus. Other risk factors include having an IUD. You're actually at lower risk of getting an ectopic pregnancy if you have an IUD in place when you get pregnant. However, if that IUD is not placed correctly, then you are at higher risk for having an ectopic pregnancy. Other risk factors include smoking, alcohol, drug use, endometriosis, and advanced age. The reason why advanced age is a risk factor is because as a person gets older, the likelihood of having pelvic inflammatory disease increases, as does the likelihood of developing endometriosis. So what are the symptoms of an ectopic pregnancy? The first symptom is abdominal pain. Now, this pain is not like normal menstrual cramps. This is more of a sharp, stabbing, persistent pain that usually starts suddenly. It can feel different depending on where exactly the embryo has implanted within the tube. Some people describe it as feeling like a stabbing pain right on the spot where they think the embryo is implanted. Others may describe it as more of a pressure or fullness on one side of the abdomen. Oftentimes it feels worse when you move or cough or sneeze or change positions. Many women describe it as feeling very different than normal menstrual cramps. The second symptom is vaginal bleeding. Now, this can look like any kind of vaginal bleeding. It might look like spotting. It might look like heavy bleeding. It might be bright red. It might be dark. It really depends. And sometimes there's no bleeding at all with an ectopic pregnancy. However, if the embryo continues to grow, eventually the sac will rupture and there will be internal bleeding and it will start to show up vaginally. Other symptoms that can occur are shoulder pain, dizziness, lightheadedness, nausea, vomiting, and fatigue. These symptoms occur due to the internal bleeding and the anemia that can develop as a result of that. So how is an ectopic pregnancy diagnosed? So the only way to diagnose an ectopic pregnancy is through an ultrasound. There is no blood test or other way to diagnose it. An ultrasound will show an empty gestational sac that doesn't have a heartbeat at the expected time of the heartbeat. It will also show bleeding in the abdomen and/or the pelvis. How is an ectopic pregnancy treated? So the treatment for an ectopic pregnancy is a medication called methotrexate. Methotrexate is a medication that induces abortion. It prevents the growth of cells that are dividing rapidly, like a growing embryo. So that stops the embryo from growing and allows the body to absorb the tissue naturally. However, there are certain criteria that a patient has to meet to be able to receive methotrexate. First and foremost, the patient has to have a negative pregnancy test. Now, when you go in for your first ultrasound, they won't be able to get quantitative data from the ultrasound. They may just see a gestational sac without seeing a yolk or a fetal pole. So they won't be able to measure HCG levels from the ultrasound. But the HCG level will be very low. Then you have to have a transvaginal ultrasound showing that there is no viable intrauterine pregnancy. So no heartbeat seen, no fetal pole seen, and then you need to have a serum HCG level less than 5,000 LMIU per ml. You also have to have a hemoglobin level greater than 10, So that means you have to have enough red blood cells. And then you have to have a signed, informed consent. If those patients do not meet these criteria, they'll have to wait until their HCG levels drop and then get repeat ultrasounds and repeat blood work to check their labs and then sign an informed consent. There is also a surgical management option for treating an ectopic pregnancy. This is called a laparoscopy. A laparoscopy is a surgery where a small incision is made in the abdomen and a camera is inserted into the abdomen to identify the fallopian tube that needs to be removed. The fallopian tube can then be tied off and cut or untied and sewn back up if the patient desires to preserve her fertility. If the patient desires to get pregnant again in the future, then they should consider preserving the tube. It's possible to get pregnant in the remaining fallopian tube. However, there is a slight increase in the risk of having another ectopic pregnancy if the patient chooses to keep her tube open. After treatment, the patient will need to have follow-up ultrasounds to ensure that the HCG levels have dropped to 0 and that there is no remaining tissue within the abdomen and/or the pelvis. I know that ectopic pregnancies are so scary. I've had several during my training, and it is extremely devastating when this happens. But I hope that you guys feel more educated on ectopic pregnancies now. If you want to learn more about infertility, you can check out this video right here. Thank you so much for watching, and I will see you next Monday.